When you are trying to understand the NCLEX, and what you understand about the NCLEX is just the NCLEX is a licensure exam, right? You are still going to ask what you need in order to pass the exam. It means that what you understand, which is the NCLEX is a licensure exam, is not enough for you to know what you need in order to pass the exam. Now, when you are trying to create understanding, you want to understand what you are doing in a way that you have no question to ask. It means that when you have no question, it means that everything is clear. You know the next step, you know what to do just by understanding what you are getting yourself into. Like, take for instance, now, let us say this is a restaurant, right? Let's say this is a restaurant, but it's just like a restaurant. You just put it's a restaurant. Now, and let us say you want to buy pizza. Guess what? You will not be sure if they have pizza in this restaurant because it's not indicated. Only what they just say is this is a restaurant, right? Now you need to ask question and say, oh, do you have pizza here? But guess what? Let us say instead of this should just be a restaurant, they put pizza restaurant. Now, guess what? Me and you, we are not clear that when we go in here, what we are going to get is what? Pizza. Now, that is what happens when you just understand that the NCLEX is just a licensure exam. Instead of understanding what the NCLEX is all about, that give you the ability to know what to do in order to get that license. Now, I'm going to explain NCLEX so well for you because this is your foundation. Once you understand this, you know what to do. The reason why a lot of students struggle is because they don't know what to do. They are overwhelmed, they are confused, they are tired of all the whole process because it's stressful. Now, let's clarify one thing. Let's agree with this particular thing before we move on. If you want to make money, right, what would you do in order to make money? I believe if you are thinking like me, we need to get a job, right? If you are sick, what are you going to do? If you are thinking like me, we are going to go to the hospital. Now, if you want to pass any exam, if you are thinking like me, all we need to do is to read, right? Make money, you get a job. If you are sick, you go to the hospital. If you need to pass an exam, you read. Now, I've been coaching for the past 3 years. I've asked many students who have failed the NCLEX exam, what do you need to pass your exam? And the answer is, I don't know. Why? Because they are over complicating the process. It's very simple. Exam, read, seek, hospital, make money, job. Now, the problem is not that we don't know what to do. We know what to do. But the problem is now doing it. That is the problem. This is where a lot of students have their problem when they're about to carry out the action. Now, for somebody that is trying to get a job now might say, okay, I know I need to get a job, but I've been trying to get a job. I've not seen the one I like, or maybe I don't fit into most job, or maybe they have difficulty getting job. Right now, hospital, maybe the person is so sick that they cannot get themselves into the hospital. They don't know what hospital to go to, something like that. That's the problem. Now, related to reading, might not be you don't know what to read, or you know what to read, but you don't know where to read it, or you are struggling with retaining the information, or you have like your work, your family issue that is stopping you from reading effectively. Right, those are your problem. So it's not that you don't know what to do, but when you are doing it, you have problem. So when I am trying to fix your problem as a coach, I am fixing those things that cause you not to study or read effectively, which is one, you might not even know the content. Two, you might know the content, but you don't know where to read it. Three, you might struggle with retaining, right? the content. 4, you might have work problem or family issue that is stopping you from reading effectively. So this is what we want to fix for you. Now, if you don't fix all this problem, guess what? That is where anxiety kicks in. That is where the feeling of I don't think I am ready kicks in. That's where the feeling of I am overwhelmed kicks in. Because this is what you have not fixed that is causing all those problems. Right. That's the problem. Now, I'm going to tell you what you need to understand about the NCLEX exam, right? So that you know what you need in order to pass the NCLEX exam. But I'm just trying to like walk you through the process. Now, many students struggle with anxiety, right? And they think anxiety, um, maybe it's a mental problem that they need to fix. Now, let me tell you something. Anxiety. Let me explain something real quick now. If I tell you 1 plus 1 and ask you, you have exam anxiety. Let us say this is your exam question, right? Because many students will say, "Oh, I have anxiety when I'm taking the NCLEX exam." All right. Let us say this is your NCLEX question, and your number one question is saying, "What is 1 plus 1?" Are you going to have anxiety to do this question? Obviously, no, because you are going to say 1 plus 1 is what? 2. So you don't use anxiety in order to answer this question. We believe it's 2. Because 1, we are clear, we understand what we are doing, and we are sure. Right. So we are clear that this is all about what? Addition. We are trying to add, right? Addition. Now, when we add 1 plus 1, we know that it will give us a value. So we have a clear understanding that this question is saying we should add something so that we can get a particular value. Now we are sure that when we add 1 plus 1 is going to give us 2. You see, you are clear, you understand, you are sure. Now these 3 things, we need it in order to like eliminate anxiety. If you don't want anxiety, these 3 things must be there. Now let me give you another example. Let us say somebody is trying to fight with you, and this person happen to be a very big guy, but you happen to be the smaller person. Now, what is making you to have anxiety is that you are clear that this person is bigger than you. You understand that this person have more power than you, and you are sure you will not win that fight. But what of if you are clear that this person is going to come with nothing? You understand that this person has nothing to fight you with, and you are sure that this person will never get anything to fight you with. But you are clear that you are coming, right, with a gun. You understand that you know how to use the gun effectively, and then you are sure that once the fight starts, you are going to shoot the gun at this person. Guess what? You will not have anxiety again. So it will not be about how big the person is. It's about the fact that this person is coming with nothing to fight you, but you are coming with a gun. So you are 100% sure, you understand that once you come with a gun and this person come with nothing, you will be able to defeat this person. Now, when a lot of students think about the NCLEX exam, they think about how much content they need to study. So when they think about how much content they need to study, they get overwhelmed and then anxiety comes in. But what if I can tell you that we don't have much content, but we have certain amount of content? Now, me and you are not clear that we are going to start here and we have where we are stopping. So we know that these are the content we need to do. So now you are not going to think about much content, but you will think about the certain content that you need in order to pass the exam. Right. Now, I always used to tell students, anxiety is the fear of the unknown. Once you know what will be on the exam, just like the same way you know this guy is a big guy, you are a small guy. You are scared because if he likes the big guy. But now you are planning to bring a gun but you don't know if this person is going to bring something as well too. But now the moment you know that this person is bringing nothing, you are not scared again, because you know 100% you are going to defeat this person. So the fear of the unknown is that you don't know that this person is going to bring something or not. But when you instantly know that this person is not bringing anything, you instantly know that you are going to defeat this person because you are bringing a gun. Right. So anxiety is the fear of the unknown. The moment you know, right, that this is what matter for the NCLEX exam, anxiety will be out. Right. So one is, in order to pass the NCLEX exam, you need content plus question. But where are you getting the content from? Where are you getting the question is what that matters. The content, you are getting it from the NCLEX website. The question, you are getting it from the NCLEX website. Now, the content will tell you what the examiner will test. The question are past question. Many students study question bank when they should be studying past questions. Question bank is good, but past question is better, in a way that you understand how the NCLEX wants you to think. You are getting direct questions that have been previously tested before, and then you can start applying your content knowledge related to those kind of questions. Right. Now, let's go back to what the NCLEX is all about in a clear way. It's very simple. Now, NCLEX previously, before, you have been told that NCLEX is a licensure exam. Now, this is the NCLEX right here, and this is your license right here. There's a bridge that you need to cross in order to get your license. Now, one, you want to understand that the NCLEX is an exam that you need to pass. So the first thing is you need to what? Pass. And how do you pass? You need to show the NCLEX that you are a safe nurse. So NCLEX is trying to test to see if you are a safe nurse. Now, how would the NCLEX test to see if you are a safe nurse? Related to the 8 client needs. Right. So, you see, the NCLEX you need to pass by showing that you are a safe nurse related to the 8 client need. Once you pass all this area, you end up what? Getting your license. Right. Now, you know you need to pass. You know you need to show that you're a safe nurse. And how do you show that you're a safe nurse? Related to the 8 client need. Now, the next question you'll be asking me right now is, what are the 8 client need? And how can I study the 8 client need? Now, previously I said in order to pass the NCLEX exam, you need 2 things. You need content, you need question. Right. The 8 client need, right, is what you need to know. For the NCLEX is for RN and PN. Now, for RN, we have the 8 client needs. For PN, we have the 8 client needs. Right? We have management. For RN, we have management of care, safety and infection control, health promotion and maintenance, psychosocial integrity, basic care and comfort, reduction of risk, pharmacology and parenteral therapy, physiological adaptation. Now, for PN, is the same, but instead of management of care, we have coordinated care. And instead of pharmacology and parenteral therapy, we only have pharmacology. That's the difference. Right? So that's the 8 client need. Now, you don't just want to know the 8 client need, you want to know the content in each of them and how the NCLEX write the question related to each of those content. So with these 2 powerful tools, you have the ability to what? Pass the exam. Now, this is the problem when you try to do it on your own, right? Or when you get a coach. Now, think about it like you have a book, a textbook. And when you are reading this textbook, 100 pages textbook, what you are doing is to highlight where you think will be important so that you can come back later in order to study them. Right? Now, you've done highlighting of 1000 pages, and when you are ready to come back to study them, you got tired. You got overwhelmed. Why? Because when you were doing your highlighting, it was making sense to you because you were like, oh, this is a key point, let me highlight it. This is a key point, let me highlight it so that I can come back to understand it. Now, the moment you now come back to understand it, you now notice that you are not even understanding it. Now, at that point, this is what students start thinking. Students don't think about this problem now. They start saying, if I am having problem with this, guess what? There are other things I have highlighted as well too. Meaning I'm going to start having problem in other areas as well too. So at that point, they start thinking of giving up. They start thinking of what they can do best. Now, it's going to cause a lot of problem. That's why a lot of students don't end up feeling prepared. But now, see what happens when you get a coach. Now, a coach will be by you physically, online, most especially I do online, right? In order to guide you through the process. The same textbook, but this time around, the same 1000 pages, but this time around, you are not doing anything than to pay attention. So the coach is reading it alongside with you, telling you, okay, this is what we need to know. And instead of us to come back to understand it, the coach is instantly telling you what this is, right? Now, the coach is telling you what it is and how the NCLEX will test you. What it is and how the NCLEX will test you. Alright, so it tell you this, tell you this, tell you this. So all you are just doing is just to pay attention. Right. So your duty is to pay attention, get the information right based on the coach telling you what it is and how the NCLEX is going to test that particular information. Right. So that way, the coach is guiding you through a process, a step, or a roadmap. So this way, we are clear. Right? You don't need to have all this thinking. All you just need to do is to pay attention. So when you are trying to do it by yourself alone, let us say you are trying to do it like alone, you will go through the stress and you might end up what? Giving up. But once you have a coach, you are paying a coach to help you bypass the stress, being overwhelmed, not knowing what to do, feeling confused, so that you can have an easy process that easily walk you through getting what? Your license. So you get to now decide if you like to struggle on your own to get it right, or you don't want to struggle, you want to get a coach that is just going to walk you through the process and you are 100% guaranteed in order to get the license. Now, the risk of doing it on your own is you might get to fail the exam, you waste $200, you waste your time because you could have started working as a nurse, right? Your family gets disappointed in you, you get disappointed in yourself, your friends get disappointed in you, right? And you still need to now pay another $200 when you could have paid just one time payment of $497 to a coach that is going to hold you by the hand and walk you to becoming a licensed nurse. So you are not paying for just cost, right? You are paying for transformation, right? Because the coach understands what it takes in order to help you pass the exam. The coach have the blueprint that can help you pass the exam. Like I said, in order to pass the NCLEX exam, all you need to do, right, is to read. The problem is now this. Now, a coach understands this problem because a coach should be able to diagnose your situation, create a plan based on what we have diagnosed, and then help you to execute that plan. That way, we are working ourselves towards what? Passing. Right. Now, when many students are trying to study alone, they don't know how long they should study for. That is why a coach that have all this in plan will now tell you we can do this within 60 days. Right. And then at the end of 60 days, you have the ability to what? Pass the exam. Now, the difference between students that don't struggle and students that struggle is the ability to act. Right. Is the ability to act. Many students will say they want to act, but they will not go far with doing it. But many students that decide they want to act, if you notice, they end up having somebody by their side that make them go far. and even not even going far, but finishing the process. So if you are somebody that understand that you don't want to fail again. Now, many students, their situation right now is not all about failing. Their situation is they are failing multiple times. It's not about failing, like, oh, I failed. Many students is not, oh, I failed. Their situation is not, oh, I failed. Now, their situation is, I've been failing multiple times. I've seen students who fail 7, 8, 9, 14 times. 4, 5, you name it, 1, 2, 3, yeah. I've seen all this number. I've seen 6. I've seen 1, 2, 3, 4, 5, 6, 7, 8, 9. I've not seen 10. I've not seen 11. I've seen 12. And I've seen 14. I've not seen 13. Right. And all these numbers you can see right here, they join my coaching program and they end up passing on their very next attempt. Right. Just by following a clear roadmap. Right. Now, let me explain the difference between question bank and coach to you. I've explained coaching to you, but let me explain question bank. Now, question bank is like you are sick. Then, this is your solution right here, which is the hospital. So, you go to the hospital, and you enter the hospital and you start looking for medication that you need to use. You are looking for medication that you need to use. So you pick medication 1, medication 2, medication 3. Guess what? You are going to pick the wrong medication. That's definitely going to cause you to die or have more problem. But a coach is when you go to the hospital, you have somebody waiting to check you up, know what is the problem, and give you the solution. Now, when you get a question bank program is just like going into the hospital, picking random medication that you think will help you out. Because when you are doing question bank, there's nobody guiding you. You are the one that you are guiding yourself. But if you have a coaching program, guess what? There's somebody waiting to know your problem, right? Because normally hospital is going to start with assessment, diagnosis, planning, intervention, evaluation. Right. This is what coaching program is also all about. Assessment, diagnosis, planning, intervention. We want to assess to see your problem, diagnose to know your problem, create a plan, implement it, and when you end up taking the exam, which is your evaluation, you are 100% going to pass. But question bank don't do these things. Question bank don't assess to see your problem. Instead, they believe that you already know your problem, right? All they just want to do is to give you the implementation, which is questions that you are answering. So all you are doing when you are doing question bank is to answer question. Now, when you fail a particular question, they give you a mini solution to why you got that question wrong. That's the reason why there's a particular student who was trying to answer a particular question on a question bank related to SIADH. Now, when she answered that first question, she got the question wrong. When she went through the rationale said, like the question was asking which of the following orders should the nurse question. Then the question said she should have questioned this order normal saline. Right. Now, she saw another question. After answering few other questions, she came across another question related to SIDH again. And then this time around, she saw a particular answer that said, because the question also tested the same thing, which order should the nurse question? She saw normal saline this time around, she selected it, she got it wrong. Now, she was forced to screenshot this question, and she was forced to screenshot this question, and she sent it to me. And she was like, Coach, I selected normal saline here. It's wrong. I understand that the rationale is telling us that these patients have fluid overload, so we cannot give normal saline. But now I'm selecting it here as well too, but it's telling me that I'm wrong. Is it that this program have problem or what? Now, when I look at the question, like if you join my coaching program, if you find difficulty with any question, guess what? I know you don't understand the main content. which is the SIADH. Because once you read something so well, you should not have difficulty with that content again. If that question, like, it's just like if you read SIADH so well, even if NCLEX tests you 7 different questions related to SIADH, you have the ability to answer all 7 correctly. That is how my coaching program works. But if you are trying to answer a particular content and then you struggle with one question and you are getting another one, no. It shows that you don't have perfect understanding. And this is where anxiety starts coming in. Anxiety come in when you are seeing problem. In my program, I try to remove problems so that you feel prepared. You feel certain. So when you go on the exam, you walk out as a licensed nurse. Right. So one, I knew that we need to study SIH. That is one. Two, I tried to explain the problem to her. And this is what the question bank did not explain to her. Because they always said this, but it was not clear to her that there's more she needs to know about the normal saline. Which is, yes, the question was saying the patient have low sodium, right? And they need to replace the sodium. Now, when you are trying to replace a patient's sodium with SIDH, the fluid that you are using matters. There are certain fluid that will cause more fluid, and there are certain fluid that will not cause more fluid. So this answer that she selected that was wrong was the kind of fluid that don't cause more fluid to SIDH, but will replace the sodium. But this will cause more fluid, and that's why this was wrong. So when I explained that to her, she was not like, oh, okay, now I understand. Now, she understand, but what is the quick fix that will keep on fixing all these problems in the future? Which is when you are trying to understand what you want to study, right? You don't want to just understand just by answering questions. You want to know the main topic that will give you the ability to answer any question. You don't want to answer this question and get it wrong before you understand it. Get this wrong before you understand it. Get this wrong before you understand it. Get this wrong before you understand it. No, we want to understand it so that when we see any question, we are getting it wrong. There's no chance of getting it. Sorry, we are getting it right. I mean, there's no chance of getting it wrong. So, question bank, right, will not help you if you are one of this category. Right. Now, there are some certain students, because this is your roadmap. The time that you were thinking of becoming a nurse, you got yourself into a nursing school program, right? You need to pass the NCLEX, and from there, you end up becoming a nurse. Now, many, according to the NCLEX believe you have every knowledge you need because you graduated from nursing school in order to pass the NCLEX exam. That's what the NCLEX believe. But there are some students that they struggle in nursing school. They still need extra help in understanding the content. There are some students that they don't know that they don't need extra help. That is why when they use question bank, even without not getting that extra help, they end up passing the NCLEX exam. Why there are some that need extra help. You might be that particular student that need extra help. Now, two students, one that don't need extra help and the second one that need the extra help. Right, you might happen to be that particular student that need extra help. So it means that your own journey will be you finish nursing school, you get a coaching program, and then you end up using question bank and you end up what? Passing the exam. Why? Some students will just go from finishing nursing school, question bank, and passing the exam. So that is why you need to understand your own situation. Everybody's situation or every student situation are not the same thing. You need to understand your own situation so you know your own roadmap. Yours might be to get a coach. Now, how would you know if you need a coach? You likely have failed the NCLEX exam 2 times after using question bank, 3 times, 4 times, 5 times. Don't wait till when you start failing 3, 4 times. Because if you fail 2 times, you've done a question bank of 2,000 questions, only to answer NCLEX 85 to 150 questions. So what you are trying to say is that 2,000 questions is not enough in order to help you pass. And if you fail 2 times, that is 2,000 times 2, that is 4,000 questions you've answered, and you did not end up passing the NCLEX exam. So imagine failing 7 times. right? That is 14,000 question, and that student is still having difficulty to pass 85 question of the NCLEX exam. It means that question bank cannot solve your problem again. Instead, you need a coach. You need a coach, and a coach will walk you through the process of passing, making you understand why you keep failing. Now, if you decide you want to avoid getting a coach, right, let me tell you something. The mistake that you are making that you don't know about is waiting for you when you are trying to take your next attempt. It's waiting for you, and you will keep making that mistake over and over again. So if you want to have the ability to pass the NCLEX exam, right, one, you want to accept or like agree that you need help. Then you need a coach, right? And then once you do this, you end up having the ability to walk through the roadmap that is going to help you to pass, right? That is going to help you to pass, right? So yeah, this is everything you need to know related to the NCLEX. In order to pass the NCLEX exam, is always these two things, right? You need to know the content and you need to know the question. Not just any question, you need to know the NCLEX pass question. I need to know the NCLEX content, right? The NCLEX content, not just random content, the NCLEX content, right? If you join my coaching program, I'm going to give you the NCLEX content and I'm going to give you the NCLEX past question. And from there, once we go through this, we have the ability to pass the exam. Now, if you join my coaching program is a 60-day coaching program. So by the end of 60 days, you have the ability to pass the NCLEX exam. Right. So if I tell you to pay me $8 every day for 60 days, and that will guarantee you to pass the exam, are you going to take this offer? Right. I'm just taking $8 from you every day, right, for 60 days to help you pass the NCLEX exam. Right. My coaching program, because many coaches, right, we charge you $120. I've seen someone that charge $75 per hour, right, per hour, right. So now if you say $75 per hour, let us say we are doing it for 60 days, right, times 60, it means that you're going to pay $4,500 for 60 days. Right. Now let us say maybe I'm charging you $120 per hour for 60 days, meaning you are going to pay $7,200 for 60 days. Right. But what am I charging you? I'm only just charging you $497. So if you say $497 divided by 60 days, right? Divided by 60 days, you are going to get $8.28, right, for 1 hour every day, right? So yes, so yeah, this is it, right? So it's a good offer, and you don't even get to pay everything in full, as you can also pay using payment plan, right, which is to pay a down payment of $250 and tell me when you are going to make the next payment, right? And yeah, that's it. Like if you pay $250 now, just tell me when you're going to make the next payment in within 30 days. Right, within 30 days. So from the time you make the next payment, before the next 30 days, just tell me when you're going to make the next payment. Simple, which is the next payment is $50, right? So now the only thing that will stop you from not doing this is if you still like to struggle. But if you don't want to struggle, right, and you're ready to pass the NCLEX exam, you can reach out to me on this number +1 767 613 0769. So reach out to me on this number +1 767 613 0769. So just text me. You can text me on WhatsApp, iMessage, anyone. Just reach out to me. Just let me know you are interested in joining my coaching program, and I'm going to enroll you in. Right. With that being said, I'm going to see you in the next one.